name is Laura Bloom, and on behalf of Global Genes, it is my distinct pleasure to welcome you all to this session on F This, Challenging Taboos in Sex and Sexuality for Rare and Disabled People. Thank you so much for taking the time to join us. So now let's begin this session. F This, Challenging Taboos in Sex and Sexuality for Rare and Disabled People. I'm going to introduce myself. My name is Laura Bloom, as I said, and my full-time job is as President and CEO of the Ehlers-Danlos Society. I'm also very proud to be a Global Strategic Advisor for Global Genes, and I'm also an academic, so you can tell it's late in the UK here, academic affiliate professor of practice in patient engagement and global collaboration at Penn State College of Medicine. And I've been working in the field of rare diseases and chronic diseases for about 11 years now. And I think that we don't hear enough these conversations. We don't touch on these subjects that affect people. As a queer person living with a rare and chronic condition, I think this is really important. And I wish that all those years ago, 20 years ago now, makes me feel old, when I was coming out and wanting to ask lots of questions related to how I deal with relationships, sex, intimacy, as well as living with something like EDS, there was just no safe space to have those chats with. So I'm delighted that Global Genes is hosting this conversation. I'm very happy to be involved. And I'm now going to hand over to Anna, who's going to introduce herself as our co-moderator for today. Anna, over to you.
Thank you so much, Laura. Hi, everyone. I am Anna Laurence, and I am the head of programs and initiatives of Our Odyssey, and my pronouns are she, her. I echo everything that Laura said about this session and the importance of it happening. So my full-time job is as a social worker at a preschool that serves low-income families who are underserved, as well as my last full-time job being a prevention educator at a sexual violence resource and children's advocacy center. And so for me, I come at this discussion in a lot of different ways. One, as someone with rare disease who is also part of the queer community, but also professionally coming from sexual violence and child advocacy. So I'm so incredibly thrilled that we're having this discussion. I hope that these discussions continue to happen more often and more frequently. And I am just really, really looking forward to hearing from you all and our speakers, as well as the questions that you all submit. I'm super excited. And I'm going to go ahead and pass it to Cam.
Hi, I'm Cam Redlusk. I'm an artist, writer, a disability and rare disease advocate, and also an industrial designer. I'm a Korean American adoptee. I was actually born in Daegu, South Korea, and then I was raised in Michigan by the family that adopted me. And during college, I went to design college and I came out to California. I've been living here for about 15 years. And it's also where my advocacy began. I've been an advocate for about over 13 years. I have a very rare progressive muscle wasting degenerative condition called GNM myopathy that basically takes your body to complete immobility. And I've had it for about over 20 years. It started in high school and I went through the diagnosis process in college. And for me, my form of advocacy is I'm a writer, I travel, I share my travels, and all my illustrations and art is based on moments of my experience with my progressive disease, as well as working on a children's book based on disability. And my form of advocacy is being very open and sharing, including sex and disability. I've done a number of interviews on the topic and wrote about it. And I think it's such an important topic for non-disabled and disabled. And I've just found that a lot of people are just too shy to talk about it, even with their own partner. So I'm really excited to be here and thankful for Global Genes for inviting me. And I'm going to hand it off to Amber.
Hi, Cam. Thank you so much. My name is Amber Minty. I am a patient for, sorry, little technical difficulties. Okay, so my name is Amber. I am the founder of Living With This. It is a blog where I focus on my journey with multiple chronic illnesses, insecurities, living with them, and how to pretty much live with them, basically. I am extremely passionate about body positivity and sexuality, and I personally feel it is a conversation that needs to be had in many, many areas. Let's start. If my thing doesn't want to work today. Okay, so I want to focus more on the sensuality, intimacy. How is sex not just physical? What really impacts sex, and why are we not having these conversations? Insecurity, confidence, and intimacy all affect sex. No matter what we want to say, they do impact them. This is a quote my partner actually said to me briefly a couple years ago. It's just kind of really stuck with me. Sex is deeper than a few inches of penetration. It's a mental thing, a soul dance. Make the mind lose it and the body will simply follow. It sounds weird, but I'll go into it a little bit more. Now let's talk insecurities. We all have rare illnesses. We all have chronic illnesses. How does that play into this? For me personally, and I've actually polled some of my community, feeling unworthy, feeling like a burden, having a feeding tube, an ostomy, use of mobility aids, severe fatigue, and joint issues. I also have Ehlers-Danlos and postural orthostatic tachycardia syndrome, as well as another arrhythmia on side of that, as well as stage 4 endometriosis. That plays a heavy duty path in my sexual intimacy with my partner. You define your beauty. Society doesn't define your beauty or your worth. That has stuck with me, and that has been my mantra for the last 2 years. Now let's talk confidence. I recently wrote an article that was published by The Mighty. What helps me overcome my insecurities as someone with chronic illness? As weird as it is, photo shoots have helped me. You would think you're burying everything. How does that help me? It really helped me to see past what I could not see past, what my partner could see, but I could not see. Lingerie, as cliche as it is, my boyfriend actually told me it's like your armor. You put it on and it's like your alter ego, your Sasha Fierce, you're a different person. You embrace who you are. And again, it sounds cliche, but it's worked immensely for me and our sexual intimacy and our relationship. Clothes. Wear cute clothes. You have an ostomy, it doesn't matter. You want to wear a crop top, wear it. You have a feeding tube, you want to wear a bikini, wear it. Let's embrace who we are, and that helps our sexual intimacy. Nails. I know that's a silly one, but again, goes back to my armor thing. I love having cute nails. They make me feel pretty, which in turn makes me feel more confident. These are some photos that I had done at a photo shoot. The picture on the left and the red dress is one of my favorites I had done. Red is my color. I call it my power color. That is when I'm the most confident. The bikini picture, that took a lot of work, a lot of self-help, a lot of work to get me to a point where I was courageous enough to pose in a bikini with everything showing. My ostomy, my feeding tubes, everything is out there. And in turn, it really helped open more discussion. Now let's talk how we get physical. What are suggestions for how? This is extremely dependent on your situation, and we'll talk more about this in depth in our Q&A. For me, with my POTS and my feeding tubes, we've spent a lot of time learning what works and what doesn't, what positions work, what are not feasible for an Ehlers-Danlos or a POTS patient. They will just make things 1,000 times worse. For us, flirting, it's super important. It keeps things kind of fun. But my biggest piece of advice, learn your body, know your body, trust your body, communicate your needs, limitations, and what works for you to your partner. And that is it. I will pass it back over to Laura.
Thanks so much, Amber. I'm actually going to hand it back to Anna, who's going to kick off with our first question to get us all talking today.
All right, you all. So I think that the place that we really want to start is something that actually Laura mentioned in the disclaimer about a safe space, right? So we want this to be a safe space for you all to ask questions, but that's just for asking questions. Nonetheless, when we're talking about sex and intimacy. So I would like to start by asking our wonderful speakers about what does it take for you all to create a safe space? And I'm going to put it over to Cam first, if that's okay.
Safe space in general, in terms of when it's, I'm sorry, can you ask that question again?
Yeah, no, of course. So I was talking about having a safe space, whether it is, I mean, really for this topic in general, for you, whether it's communication, whether it's when you're actually having sex, things like that. What does it mean to create a safe space for you?
I think just being mindful of everyone in terms of reading cues that are not so verbal, or in terms of how their comfort level is, and just kind of reading a room and knowing what to talk about and what not to ask, and being, considerate about other people's stories, and just always making sure when you're engaging in conversation that it's, consensual and everyone is feeling comfortable in it.
Thank you so much. I think that's a really great point. Right, communication. I feel like communication is like the biggest thing, and not being afraid to communicate. Amber, do you have anything to add to that about creating a safe space? Oh, I believe you're muted, Amber.
Sorry, we were having puppy problems. I think a safe space is just, it really, there needs to be one. You have to have that line of communication, not only with your partner, but we need a safe space within the community where we can have these conversations, because we all want to have these conversations. We just don't know where to go to have them. And I think that is so important. And my partner and I, we've had the conversation over and over. I mean, it's an ongoing conversation. And I think that's helped so much to create that safe space within our relationship. And I think that's something that every relationship should and needs to have.
Yeah, that's a really great point. Not only a safe space with you and a partner, but also a safe space in our community, right? We talk about connection all the time and getting tips and tricks for how to deal with symptoms and all kinds of doctor's appointments and all of that and advocacy. But what about this? I think that's a really great point. Thank you so much, Amber. Laura, I'm going to pass it over to you for our next question.
Thank you. And just commenting on that first question you posed, I think that also the important thing is to remember we're people, we're not patients when it comes to sex. When we're in the bedroom, when we're in everyday life, the only time we're a patient is when we're in front of a doctor. And so that's really important to remember, that in itself creates a space that we're just human beings that want to have a good time in the bedroom or anywhere else, and we want to be able to have the freedom to talk about that and be a person first with needs versus a patient first with a disability or condition. So that to me is kind of the first thing that we will need to grant ourselves and go into a community conversation with. So I just wanted to put that out there as well. And it kind of brings me up to what I wanted to ask is, something I've always struggled with, as I mentioned, I've always been in relationships with women, and I'm more androgynous, and I've always wanted to be more of the kind of butch person in a relationship, carrying the heavy bag, sweeping someone off their feet. And you have such a kind of visual vision of what that is. And when you have a body that won't match how you feel inside, that can really be incredibly challenging. And for me, always in parallel with growing up, with having relationships, with discovering sexuality, intimacy, has been this feeling of feeling like a burden. And that's not just a burden when it comes to sex. It comes to so much more than that. It's, having to leave early because you're tired. It's being able to not turn up to things and inflicting that on a partner or friends or family. Having days where you feel like you could jump around and dance around, and then the next day for no clear reason you just need to lay flat on your back, and that look that even those that know you and love you the best will look at you with, and you can almost hear in the back of their mind, either real or just what you're putting onto them, you were okay yesterday. And it's that sense of, I'm ruining everything, people can't just plan the way they want to, and I remember friends going, I just want to kind of pick you up and scoop you up, but I'm going to hurt you, aren't I? And actually that's them being really thoughtful and considerate, but it makes you feel like a burden that they can't just hug you and squeeze you and wrestle around like you want to. And the same with physical sex with partners. So for me, I want to talk about, how do you overcome feeling like a burden and bringing that into a relationship, whether it's the physical, the conversations, the communication, your mental health, accommodations. I'd love to hear what you say. And Cam, we'll kick off with you.
I loved what you said, that we are only a patient when we're in front of the doctors, because I think that feeds a lot of non-disabled society, they only see you as a patient. They don't see you as a person. And of course, when we have our own friends, non-disabled friends, they see us as a person because we're their friend and they've had exposure to us. But for everyone else, all they've been told by ableism society, including ourselves, is that there's something wrong with them. So clearly that person who's disabled or has an illness can't even like think about sex. They must not be a sexual person at all. And that's like number one right there. What you said was they view us as patients, not as people. We're people first and then patients sometimes of our lives. But the burden aspect, I think tying it back into ableism again, is just undoing a lot of what we've been told. Non-disabled society has been told there's something wrong with us, and we obviously can't be interested or can't be educated or can't be intellectual or have any talents or skills or be sexual or anything like that. And then we've done it to ourselves as well when we call ourselves burden. I'm sure we've all been with partners where we feel weird about like, oh, I got to communicate this. This is where I need help. This is this. And what I found works for me is like, there's nothing that can be done to change it. I need help with certain things. I think communication is so important, not for just disabled, but non-disabled. So many non-disabled couples don't even talk about what they like or don't like. But it's so important for us to just be like, you know what, this is what it is. And most people I've found, they take you as you put yourself out there. And if we're not accepting ourselves and thinking we're a burden, then that is definitely coming across to our partners, whether they're a first partner or a long-lived partner. And that's something that we have to do the work on non-disabled society, but also ourselves to make ourselves not feel that way, because people can read our insecurities. So I think it starts with ourselves to realize we're not a burden and it's just different, but we're able to do everything in similar ways, just in different ways.
Yeah, no, I totally agree. So often, in fact, for me, I would say 90% of the time that sense of burden is not coming from those around us, it's coming from within. And, it's how do we work through that? How do we forgive ourselves? How do we lighten the load on ourselves? Because I feel like it's only us that are packing in all that weight into our baggage. And I'd love to hear if there's ways that you have found to lighten that load. Amber.
I actually had an aha moment about 2 years ago when this happened. I was struggling mentally with getting a feeding tube. I had to have an emergency surgery that left me with about a 4-inch incision down my abdomen. I struggled. I could not cope with the outward appearance. My boyfriend's former military. He's a big macho guy, and I felt like a burden. I'm like, why are you still here? It makes no sense to me. You could have somebody thin, pretty, not in a wheelchair, not dislocating their arm, or shoulder or finger opening a water bottle. And it came to a head in about September of 2018. It's sad that I remember that. But it was such an aha moment that it stuck with me so vividly. And he looked at me right in my face and said, do you love me? And I'm like, of course I do. Like, that's a stupid question. He goes, okay, so it's that simple. I'm like, I don't understand what you mean. He goes, I'm here because I love you. It's literally that simple. He goes, but the more you put yourself down, you put me down, you put the relationship down. How can I be secure in us if you're not secure in yourself and you're not secure in the relationship, or you're putting yourself down so much, you're questioning everything? That he made me realize it was a cycle. I was putting myself in a cycle and I was perceiving what was not there. And through counseling and so much discussion with him and I, and writing, I blog so much. It was an aha moment. It was like, it's kind of, wow. Okay, so I started seeking out photographers. I started really writing and being raw about how I struggled mentally with my insecurities and how it impacted my relationship and my sexuality. And it was freeing. I know that sounds odd, but being able to acknowledge that I'm not flawless. I have so many flaws, but you know what? That doesn't take away who I am. That does not change me at a fundamental level. That does not change my relationship. That does not change me wanting to have sex or intimacy. And it's like I've always said, I mean, I may be disabled, I may be chronically ill, but I'm not dead, and that's, I mean, I don't want to be graphic, but I'm not dead. And I still want to have that intimacy with my partner. And that aha moment really helped me to overcome feeling like a burden and overcome, well, he's here because he loves me. He's not going anywhere. If he was, he'd have been long gone after the first hip dislocation. I mean, but having a partner really put it like out there like he did really was that I'm perceiving things that aren't really there. And I think, like Cam said, as a community, we've done this. And I don't want to say that we've done this to ourselves, but in a way we really have. We've put out that perception of we're disabled, we can't have that intimacy. And I think in a way it's harmed us as a community. And it's going to take work and discussion to fix it.
Yeah, such good points that you raise. I mean, makes me laugh. We're not dead, exactly. And I think that, when you see, and that, one thing I'd love to, all social media platforms are great, but for me, Instagram has been brilliant at opening doors to see how many people out there are so ready to put their sexy selves out there and be like, I'm a person, I'm really sexy. Oh, and I have this condition, versus I'm a sexy disabled person. And it's back to that person, patient, identity thing. And I think that that's opened so many doors that when you see a photo shoot with, lingerie and someone sitting in a wheelchair, someone's automatically like, oh, they want sex too. And it's like, well, of course, why wouldn't we, and why would that make a difference? And then it goes back to how we kind of that back on self of, oh, I shouldn't want that, I feel like a burden, and so on. Anna, what are your thoughts?
Oh my gosh, I want to clap to everything y'all are saying the whole time. And also the chat is on fire right now, echoing everything y'all are saying. Just wanted to let you know that. Yes, it's so funny that we brought up lingerie and pictures, because that was the same thing that I did. And it was a spur of the moment. My friend is a makeup artist. She had just teamed up with a photographer, and she was like, I need someone else, so he'll keep booking me. And I was like, I love you and I support you, so I guess. And it was a boudoir shoot. And I was like, what? Freak out, utter freak out. I was like, it's for my friend. It's for my friend. It was life-changing. It was truly life-changing. I can honestly say I had never seen myself as sexy or as attractive, ever. I'm very short-statured because of my condition. And that, along with how oftentimes I think disabled people are often treated as if there's a word for it, but infantilized, they're treated like infants, we're babies. And that kind of cuts off this, it's there's no expectation for you to be anything but that. And that's kind of how it had always been for me. And so I very much just identify with by having that moment. I remember seeing the pictures and being with my friend and being like, am I hot? Oh my gosh, no one told me. and so it was that really powerful moment. And that was when I echo what Laura said about social media. That was when I really started to get on Instagram and follow some really amazing advocates like you two, who are taking these really vulnerable pictures and putting them out there and being like, no, this is me, all of me. And I think that is so powerful and so influential, and we need that safe space to do those things. I also want to bring up, because I think I might be the only single one here, so I also want to bring up, we talked about having those conversations and feeling like a burden. And so I know for myself, as a single person who, goes and has fun with people, that's a lot. It's even harder, I think, sometimes when it's not someone you are in a relationship with. And so I find it really interesting how you all were saying it's what you put off. And I very much agree with that. I think when you put off that confidence, that's really important. But I want us to get into the nitty-gritty, though. We're going to do it. So when it comes to having sex and sexual acts, how do you all do that? like given your conditions and things like that, what are some tips and tricks that you all have? Cam, are you cool if I start with you?
Yeah, sure. So I've had my condition for about 22 years now. And so I've been in all stages of disability, walking with a cane, leg braces, manual chair. Now I'm in a powered chair, and I don't have much arm movement. I can use my hands to draw and write and do all that. The thing with, like I said, communication is number one with every partner I've interacted with, whether it was when I was dating. And just to also nod to when I was saying that it's on us, obviously also it's so difficult dating in general if you're not disabled, but much more so when you're disabled, and much more so I think for women in a lot of ways, because you have to worry about safety and things like that. But I just found communication is number one. Like you said, you put yourself forward. This is who I am. They kind of just accept you as that. Like, oh, she doesn't have any hangups about it. And then I'm just in the moment, I just directly communicate what I need. I can't move my legs this way. I found that a lot of disabled people, I think we think very linear. We've been told, and a lot of that is a representation, not just not seeing disabled, but in general, we've seen one kind of race and gender for a long time, and way a sexuality should look, sex should look. It's always posed as this super hot woman that can writhe and do all this junk, flip-flops, flips, whatever. I don't know. We can't do that, but that I think a lot of people think because you can't do that, you don't look sexy, and that's not it about all. It's not about looking sexy. It's about feeling sexy. So one of them is feeling sexy is making sure you're comfortable. So in order for me, I'm a very sexual person. I've always loved sex. I want to be able to enjoy it. So I'm going to be very communicative of what's comfortable and what's not. So it's also comfortable for my partner as well. And so there's all sorts of things like sex furniture, sex swings add so much. They take off for people that have pain, takes off a lot of pressure off of your limbs and things. There's cushions, there's like straps that I've seen an SCI male use where, you know, they can't do certain positions, but having straps from the ceiling and holding on to it, being able to hold themselves up allows them to be able to do certain positions. Same with leg straps. You could have leg straps hanging from the ceiling that help, or leg straps between your legs that help hold your legs up, because a lot of us with muscle conditions, we can't hold our legs in. So there's so many tools and so many ways to go about sex, and you don't have to think it needs to look a certain way. You just need to adapt it to what's comfortable to you, and yeah, and then just start having fun.
I love that. Thank you so much, Cam. Yeah, I appreciate you also bringing up, you know, the difficulty and the nuances around dating and things like that when you're disabled. Nonetheless, before you even get into the bedroom, right? And I had never heard of some of those things, so thank you. I'm learning so much while we're here. That's great. All right, Amber, I know you've got something to add.
Oh, no. So as I mentioned, I have Ehlers-Danlos, classical type. My hips are my worst joints, which is probably not the best to have as that problem. But I also have POTS and orthostatic intolerance. So I got to be really, really careful. And again, I'm going to be nitty gritty. There is times where I'll be like, all right, we're going to be at a 4 today because I am not physically capable of doing like a 10, you know, and we've communicated it so much, and we've learned when I'm having my bad days or my not so good days, if we want that intimacy, what are we going to do? Pillows. We have worked that around in the years we've been together to learn what works. The sex swing, we have not attempted that. That has been on our list. But with, it's just pillows, the communication, we've realized there's certain positions that are just not conducive for POTS patients. Head down is definitely not one I would recommend for a POTS patient. But again, communicate what works for you. I mean, because sometimes your POTS could be good and you could be all out, I guess you could say. But it's a lot of learning. But pillows have probably been like our number one tool. But I also have endometriosis. So I also have some other issues, and pelvic floor physical therapy has helped tremendously alleviate some of the pain. associated with that. But there's so many tips and tricks, and I don't know how nitty gritty to get. So I'll just say pillows for right now overall have been a godsend in more ways than one.
Thank you so much, Amber. I always laugh when it comes to nitty gritty because of my last full-time job. I talked about consent and sex at all ages, age appropriate. So I'm always that friend who people are like, I don't know if you're cool. I was like, no, I got it. Like, I taught this to children. You're good. And adults. Like, never gonna bother me. Thank you so much, Amber. I think that's a really great point. And for me, it brought up the importance of being willing to try things, right? Also, because you might not know if it's gonna work, but being willing and comfortable enough with someone to try it out. And if it doesn't work, being like, all right, well, we learned that is not the way for us. And I appreciate how both of you also brought up how it changes, right? Whether it's our symptoms are not the same every day, like that would be great, but they're not. So there might be days where you can do X, Y, and Z, and there might be days when, like you said, Amber, it's a 4. Like we're only doing X. Like X is all that we can handle. So I really appreciate that. Laura, do you have anything to add?
I mean, not really. I think it's all been said, but I think, ultimately it's communication, and it's realizing it can be sporadic as well, right? So for you and your partner to know that some days you may have sex that you might not be able to have again like that for 3 months, and that needs to be okay. The great times, the calmer times, the times where you need more pillows, the time when you're endometriosis or polycystic ovaries. I suffer from both of those too. That can really make penetration painful sometimes. And so that changes things as well. And so just being mindful of that and being aware that there's ebbs and there's flows and these things change. Something I wanted to bring in, a question that we've had from people watching. Someone says, I know for some that the meds people take for rare conditions can limit sex drive. Do any of us face this issue, and can we comment? Because doctors often think and assume it's not a big issue, and it's not a bad trade-off. But do you guys suffer from that?
There is unfortunately no treatment for my condition, so there's really no pills or anything. So I don't really take anything. So I don't have a problem with low sex drive with pills.
Good news about the side effects. Bad news, there's not any therapies. I'm sorry to hear that. Amber.
I actually have neuropathy that has affected my sex drive and my ability to reach climax sometimes. I'm not on meds because I can't absorb most of them, but we've actually found there's creams that have helped tremendously keep that kind of the arousal going, or keep the lubrication going. That may not answer it directly, but it has helped. We've communicated tremendously of like, I'm not in it, or I'm not feeling it. And I'm due for hysterectomy, and that is probably one of my biggest holdoffs, to be really honest, with getting it, is that lowered sex drive. Is because, as Cam said, I'm a very sexual person. Our relationship is extremely passionate. I don't want to lose that, and I don't think we will, but I also am terrified of losing that confidence and that sexual intimacy that we have. So I've really held off because of it. But I definitely think that is a topic that should be had more than is, because a lot of our medications do impact our sex drive. And what do we do? How do we combat that? Because if you're not feeling it, you're not, whether you're confident or not, you're not in the mood. But for us, creams have helped, gels have helped, that are geared more towards that arousal, that stimulation, and that's helped a lot.
That actually brings us to another point that was brought up in the chat, and that is, Laura brought up how a lot of times I feel like physicians think that sex drive and that kind of side effect doesn't matter. And again, we are human beings. But someone brought up in the chat about, when it comes to pharma approaching sexuality and approaching, the representation of that, and also, the unique needs of disabled and rare and chronic patients. lost my train of thought. Here we go. Oh, so when it comes to that, do you all have, you know, what would you like to see pharma do or physicians do to kind of address this, to maybe put more focus on this aspect of our lives and not just, our physical, disabilities and things like that?
Can I step in here? Because I think for me, this is the perfect example of how patient engagement, and I say patient because in that sense they would be a patient in terms of their experiences, need to be involved from bench to bedside, from the inception. And that's not just drug trials and therapies, that's what should we have on our website, what should be on our descriptions and on our handouts and our leaflets that incorporate that conversation of sex and everyday life and work and relationships and everything. And if you've got the person living with the conditions giving you the narrative of that, then sex won't be left out, because for most people that is something that they want to consider. So I think, pharma's come a long way in bringing forward the patient voice, and I think they're going in the right direction, but I think it's still thought about in terms of drugs and therapeutics and clinical trials, and not just the kind of holistic everyday life of what it's like to live with these conditions, what side effects that these things might have, not just on a health basis, but on sex drive, on the ability to go out and have a social life, on the ability to go out and work. And if you've got that voice and that experience from the very, very start through to the end as an equal stakeholder, then things will improve.
Well, that was, yes. Again, I just want to clap every time any of you say anything, because I just feel like it's exactly how I feel and what needs to be said.
I can get back to that, Anna, if that's
okay.
Go
for it.
I think it also goes back to having the conversations within our communities. We can't expect pharma to be involved if we ourselves are not vocalizing, hey, this is a problem and we want to fix this. We want help with this, or this is affecting our life, tremendously. How can we get the help, or how can we get this out there? And I think, again, it goes back to us as the community vocalizing, hey, this is a problem and we would really like some help here. So I think it's kind of almost a full circle situation.
Oh, for sure. I think all of it is, right? Every patients are whole, like we are a whole person, just like everyone else. And that needs to be, we need to be viewed that way in all the ways, right? From physicians, from pharma, from everyone. So no, I think that's a great point. This also brings up, when it comes to providers, we have someone who put a question in on what advice would you give for providers to initiate a conversation when it comes to sexual health, or even navigating that conversation. They shared that, currently it's really not part of like the current script that providers have of going through things. So what advice do you give providers for either initiating that conversation or navigating a conversation about sexual health?
I say that that's a conversation that providers struggle with for people that haven't got long-term chronic and rare conditions. So I think that that's breaking down that taboo more broadly will then allow for it to kind of breathe into the space that we're living in as well. So I think it's, again, that priority that a healthy sex life seems to be so far down the line, and providers assume that if you're just living and surviving, that's enough. And so I think it's, like I said, that's whether someone's got something short-term, chronic or rare. And I think that is really important. So it's, again, feeding in what is important to any person that walks through the door and becomes your patient.
I was going to add to that. It's so funny how the aspect of a lot of pharmacists or providers or whatever, probably knowing that it affects sexuality, but not really thinking that that's a problem, because they're like, oh, well, they don't like sex anyway, so it's not going to affect. But yeah, pharmaceutical builds all sorts of medications for males who are having difficulty performing. And I just think that the mentality of these like pharmacists or providers needs to change, because whereas very much a viable market for those types of drugs that involve the ability to have sex, or drugs that counteract the drugs that are inhibiting us, our sexual drives and stuff like that. So it's just amazing me when I think about that and just see how it's possible. It's just the will is not there, education, to create drugs that don't do that.
I've had maybe 2, maybe 3 doctors in my entire 10-year journey with chronic illness ask me about my sexual health. And one happened to be my GYN that specializes in endometriosis in my area. And the other was my primary. Her and I have an extremely open dialogue, and that's helped tremendously with my care and navigating it, but also to let me know that no topic is off with her. I can come to her and I'm like, look, I can't reach peak. Help me. Like, I want to be able to feel what's happening or even reach that climax. What can we do? And I think there's such a taboo, as was said, with the topic in general, just with non-disabled people, but you throw in, the chronic illness, the rare disease, the disability, and it just kind of becomes even more taboo. But I also think we as patients should be also initiating these conversations. I'm like, okay, well, I want to do this. How do we do it? Like, how do we go about it? And I think if we work together, we can see a change happen.
I think that brings up another point, though, too, is this conversation needs to happen sooner. It doesn't need to happen when we are middle-aged or young adults, right? Like, I know for myself, I saw my gastroenterologist at a children's hospital up until I was about 22, and it never got brought up. The 1 or 2 times that I tried to bring that up, it was very much like, because I had been seeing, he diagnosed me when I was 6 months old. And so my doctor also very much kind of saw me as, a daughter or as, whatever. And that almost made it to where that never got brought up. And, just like we're people, middle schoolers and high schoolers with rare and chronic conditions are also middle schoolers and high schoolers who are going through puberty and going through changes. They also have these urges. They're also growing and developing in that way. And so I also think that has to be addressed. Like, that has to start being addressed at that age, because I think when it doesn't get addressed, it feels like it shouldn't be. And if it shouldn't be, maybe it's because it's not a thing we should feel. And I feel like for myself, I went through that a lot of, well, it never got addressed with me, but I know I got addressed with my older siblings who were healthy and able-bodied. So does that mean I feel like it kind of creates that environment and creates that culture of, no, that's not a discussion that's needed.
I actually, if you don't mind, I have something to add on to that. For me, if you follow my Instagram or my blog posts, I am extremely passionate about body positivity, about insecurities. Like, these are conversations, we need to be having them. But that also ties in with the sexual intimacy conversations. And I think that by those of us that are older, that are kind of stopping, not us per se, but as a broader us, the community, by stopping these conversations, we're not helping our younger members of our community. We're kind of teaching them this is taboo, we can't talk about it. But I think if we are more open about it and more open, having that openness with, there's parents in some of these groups, or when they become teenagers, 18 and older, and they're in some of our support groups, we should be letting them know you're still beautiful with your tube or your port or whatever it is, or you can still have a life outside of your diagnosis. And I think that's one thing that speaks to me so much, as I see it so much in my communities, is that struggle that I've seen, I don't know how many 17, 18, 19-year-old young women that are, I will never date, I will never get married, because who would want this? Or I don't feel attractive, I feel like a burden. And I worry, because I struggled with it in my early 30s. And how are they feeling? Because we've stopped this conversation. If we're struggling to have the conversation in our late 20s, 30s, 40s, whatever age, what are we teaching them? And I think that's something that's become so passionate to me, is we should be having these conversations. And I'm not saying go to middle schools and say sex is yay, but having that openness to say, hey, we understand you may struggle, but what can we do? Or it's okay to have these conversations. I think it's important to say, we can have these conversations. I think that's something as a community we need to become more aware of and more open to.
Absolutely. We've had another question come in that I'm going to put to us all. This person's saying they've never had any romantic relationship. They've never had any sex drive. Some may say I'm asexual, but I fear the whole discord of no sex education, no doctor having asked about my sex life, and taking antidepressants on top of a rare disability. How do I figure out if I actually am asexual or just lack of an exposure to it? I'm 30 years old. I think this speaks beautifully, following up from what we were just saying, that, you know, how do you pick that apart? Does anyone want to jump in with some thoughts on that?
Yeah, so I'll jump in, and I don't mind to share. So I have dated seriously once, and it was in high school, so I don't know if that really counts. But I kind of went through this same struggle of wondering, is it my sexuality? Is it me? Is it a me problem? Is it my condition? What is it? And I just want to say that that's overwhelming. It's really, really difficult when there's so many factors to try to sift through. You know, I know for myself, when it comes to sexuality, I know for me, it was not so much exposure of being intimate with people. For myself, it was exposing and surrounding myself with people in the queer community. That helped me a lot because I didn't have that for a very long time. So for myself, that helped a lot, was just being around more queer people, because if you're not around them, it's hard to know if you're part of that community. And so I think that was a really big help for me. I think also knowing that sex drive doesn't define, I know for myself, sex drive doesn't define sexuality necessarily, which there could be a whole talk just on that. But I just want to put it out there that, you know, I want to make sure this person knows you're not alone in that experience. I have a lot of young adult friends who have been through very similar, where they're taking antidepressants that generally lower sex drive. Plus, they don't know if they're asexual, and they haven't, you know, really been intimate or been in a romantic relationship. It's very difficult to kind of navigate that. So I also want to put it out there, you're not alone in that experience. Does anyone else?
I was just going to say amen to that. I think that, you know, someone growing up, that discovering my sexuality and being diagnosed and actually being fully in my long diagnostic odyssey, which so many people share when they're living with a rare disease, what happened in parallel. And as well as being not exposed, you know, I was that typical cliche of the only gay in the village, and there was no one around me that I could look to and that I could, you know, relate to. And I felt very, very alone, and I didn't understand why I didn't want to do what everyone else was doing. And coupled with that, I was in pain all the time. I had crutches on all the time, and, you know, with no explanation as to any of it and as to why. And I wished so much that I had someone to talk to. And it wasn't until I was 16, nearly 17, that I kissed, you know, a girl for the first time, because it was the very first time I met another gay person. And so it was like, oh, okay, that's what it's supposed to feel like. I get it now. Because up until that moment, I was just like, this is no fun. I'm not enjoying it. I don't get it. Maybe it's my health, you know, and it goes back to, you know, that exact same thing of, I'm just not feeling it because there's something wrong with me and no one knows what's wrong with me. So maybe it's all connected. And it's incredibly intimidating and scary and lonely going through that at any age, not least of all when you're a teenager. So I totally relate to that. And I didn't understand that I could be sexually aroused until I was 16, nearly 17. So I think that that's, you know, when you're a teenager, it's at that time that you're at peak. And I know this person said they're 30, but if you've not yet been exposed to something or someone that attracts you, or being able to enter it in a safe way, in a safe space, then it could just be that. But either or, the beauty is it doesn't matter. there's plenty of asexual people out there living a very full life. And so I think that's what's important as well. It's not another diagnosis to be asexual. It's a very normal thing to embrace and appreciate. And everyone is different. So I just wanted to get that out there. Any other thoughts, Amber or Cam?
Oh, go ahead, Cam.
Oh, I didn't know if we have, what was the question?
It was just thinking about that, the lines of, how do you know if you're asexual, or how do you know that you've not yet just found what turns you on?
I think what you said was a great example, because I don't have as much experience with that. But like you said, you struggle with the journey, figuring out, well, what's wrong, which there isn't really anything wrong with any of us. We are how we are. If we have certain level of interest in sex, or are different, interested in different types of people. But what you said was really good, because you were able to explore and you found out why that was. There wasn't anything wrong. You just didn't know exactly what was the trigger for you, and that's what I think everyone needs to go through exploratory. So if you hadn't had experience, try not to be too difficult on yourself, because it's everything about exploration in life. Everything is about exploring. So just have an exploratory mind, be open, don't get too down on yourself, and just, yeah.
Absolutely. Well, we're getting towards the end, and before I hand over to Anna to close out, I thought it would be really good to just all go around and give some last final thoughts on this subject. If there's anything else you wanted to share that's helped you embrace having a sex life, a healthy sex life, so often a word that's not associated with how we feel, but something that can be healthy for us all. It would be great to hear some kind of final gems from you all. We'll start with you, Cam.
So I would just say, don't take sex too seriously. It's supposed to be fun. It shouldn't be stressful. It's a very natural part of us. We all have the right to have sexuality, so don't think that you don't. Don't be embarrassed. Just because you're disabled, also, sex does not end. You can tailor and adapt everything to you. It doesn't have to look or be a certain way. And I would say, don't be embarrassed about communicating with your partner very specifically. I do. And I think a lot of people think intimacy looks a certain way, but intimacy to me is all the in-between moments with my partner where we laugh, like, oh, this is funny. I make jokes about myself, or like, can you help me with this? And we're just human. That's okay. And I found most partners don't care. They want you to be real. So don't be shy about communicating with your partner, because non-disabled have to communicate. It's not like people know what makes someone else feel good. You have to be able to open up and communicate about that. And I think also, for me, like I said, sex doesn't end when you're disabled. Honestly, the more immobile I've become, the more sexual I've become. It might also because I turned 40 a couple years ago, but my sex drive is like really high, and I've been able to do things like when I became immobile more in a wheelchair. I think it's because you place less on your physical. And if you think about it, your biggest sex organ is your mind. So in order to calm your mind, you can be completely relaxed and completely in the moment. I think that helps you so much. And for me, because everything is focused on my mind, I've been able, I don't know if I can say the O word, but like, that's when I started. And it's like all the time, because you realize it's all in your brain. It's not how you move, it's in your brain and how present you are in the moment. And so I would just say, don't rely so much on the physical aspect. Don't think that you have things missing or whatever. Bring to the table what you have, and just it's an important thing, and you should be able to enjoy it too. And I just encourage everyone to explore it and be kind to yourselves.
I love that. It's so true. The biggest sexual organ you have is your brain. I think we should all remember that. Amber.
I want to echo what Cam said. Sometimes my partner can tell when I'm a little in my head too much, and there's that stopgap between being in the moment, and it's really impacted us. But the open communication, to me, that is probably my biggest piece of advice. Know your body, learn your body, and just be so open and honest with your partner, and don't be afraid to try new things. I mean, there's definitely things you wouldn't think you're capable of that you may be. There's positions I probably shouldn't do because of my hips, but I'm not dead. And I mean, we've had hips dislocate mid-session and we're like, well, just keep going. I mean, like, we're going to stop and like, it's just going to be a repeat. But I think it's important to have the intimacy, laugh about it, don't take it so seriously. And I think once you kind of let that go, you can feel and like feel more and let go more. But as I've struggled more with my arrhythmias and my mobility, it's oddly impacted us more, and it's led to more discussion and discovering more that works. And all around, it's pretty fine, and it's we're allowed to have fun. And I think that's really what it comes down to, is we can have fun, and it's okay to have that fun.
Yeah, absolutely. And I'll just add before I hand over to Anna that I think for me, what I try and remind myself, not just as an individual living with a condition, but also representing a large community, is there is not a right or wrong way to live with a health condition, and there is no right and wrong way to enjoy sex. And I think whatever you can do, whenever you can do it, however you can do it, as long as you're having fun, as long as you're communicating, as both of you just said, that's what's essential. And let's not add more burdens to ourselves, more pain, more heartache. We've all got enough of that. Sex can be a really good outlet and a really good way to keep smiling. Anna, over to you to close us out.
Thank you so much. Oh my gosh, you all are great. I will just add that I always joke with partners that communication is the sexiest thing ever. So that's my summary of this whole talk. Also, communication is the sexiest thing ever. I love it. But huge thank you to our attendees for giving us your time, to our wonderful speakers and my awesome co-moderator for really offering such amazing insight and experiences and speaking on this topic. Please be sure, our attendees, to visit the evaluations tab to share your feedback on this session. All good things. Just kidding, be honest. And also the other sessions that you attended, please go and use that evaluation tab. It's really important. Global Genes really values your feedback, and they want to know, what did you like? What did you not like? And we also want to ensure that they provide a really great experience, content, programming, all of the above to the rare disease community. So thank you all so much for joining us today for this really amazing topic. And we hope that you'll enjoy the rest of the conference, everyone.